Good morning all. I am Dr. T. Varun Raju from TVR Laparoscopy Center, Madina, Hyderabad. So today's public talk is regarding the types of hernia, which I am going to describe it in a very brief manner so that a common person can understand what exactly the types of hernia. So there are different types of the hernias where you can see the upper part, the epigastric hernia. Then if you go down here, that is the umbilical hernia, and if it is lateral to the umbilicus, that is called as para-umbilical hernia. And there is at the groin area, that's called as the inguinal hernia, and there is an incisional hernia where the previous surgeries the patient will be having the scar, and through the scar there is a bulge. And in the groin region, below the groin and the thigh, that's called as a femoral hernia. And if you see at the back of the patient, that is called as a lumbar hernia. So if you see the picture here, it is very clearly you can able to understand that this is the inguinal hernia, which is the commonest hernia in adults as well as in the children also. So it is nothing but the hernia which happens at the groin area, where there is a defect at the groin, and the internal organs like the fat of the intestine or the intestine themselves, they bulge up, they come through this defect area at the groin area, and gradually they goes down through the scrotum and settle in a very big size fashion. So this is typically known as the inguinal hernia. If you see the another picture, these inguinal hernias may be at one side or it may be on the both sides. So this is called as a bilateral inguinal hernia. So inguinal hernia may be divided into a indirect inguinal hernia or the direct inguinal hernia, or a combination of these on the right side or the left side. Coming to the another hernia, which is below the groin at the thigh, the upper part of the thigh, that is called as the femoral hernia, where there is a defect in the femoral canal and all the fat and intestines which are there in the pelvis, they protrude, they project through this defect and forms a very painful swelling at the groin region, especially in female patients. Coming to another hernia, that is called as umbilical hernia, where the defect when the mother and child relation, when the child is separated from the mother, there is an umbilical scar, and that is a natural weak point. Through that, if the patient is obese or in pregnancy, then the intestine which is under pressure is going to come through this defect at the umbilicus. So that is called as umbilical hernia. Above the umbilicus, it is called as para-umbilical hernia, that is supra-umbilical, and below the umbilicus, that is infra-umbilical kind of hernias. This picture is showing you the typical example or the position of the epigastric hernia, that is above the umbilicus and just below the xiphisternum, and that is maybe because of so many reasons, congenital, children or adults also may be having a very big hernia. So because that is at that position, it is called as epigastric hernia. This is typically the incisional hernia, where you will see there is a scar previous surgery, and you can see there is a big bulge which is protruding out through this defect. So it may be because the suture which is done before to close the previous operation may be loose or gone away through the infection or the natural process of the pressure. So this is typically called as the incisional hernia. And this is a typical very big protrusion of the hernia, which is called as the loss of domain, where there is a second abdomen. So there is a separate hernial sac in a separate room where all the intestines, large or small intestine along with the fat is going to settle there. So these loss of domain cases are very challenging to perform, to correct the surgery, correct that with the surgery, either by some pre-optimization where we need to optimize the patient before going for the surgery, Usually that is end up with a component separation where all the muscles of the abdomen are going to slide with a very big mesh, and that would give you a very beautiful results with the management of loss of domain cases of the hernias. Thanks for listening and watching my video. And if you have any doubts, you can call me or you can take the appointment from TVR Laparoscopy Center. The number which is depicted very clearly here, this is situated in Madinaguda. Number is 9866 159 160. Thanks for watching this video.